As a chiropractor, one of the more common injuries that I look after is lower back conditions. Especially in CrossFitters, anyone that's suffered one of these injuries knows just how hard it can be to get stabilization and correction of that joint, and also how long the injury process takes to heal. I'm going to go through 3 exercises that I recommend everyone does to make sure they increase the recovery time and also limit the chances of injuries of that lower back. The first one is going to be looking at the hamstring muscles, the third one is going to be looking at the hip flexor, and the final one is going to be looking at the glute muscles. Probably the most common and most highly recommended stretch that I give, not just to anyone that does CrossFit, for anyone suffering any form of lower back stiffness or tightness, is going to be focusing on maintaining and increasing the mobility of the hamstring muscles. This is crucial for anyone that has a job that involves them sitting down during the day or does a lot of driving. Reason being, when the knee and the hip is bent, this muscle will actually shorten. So when you stand and you do a lot of lifting, it will really lock in that pelvis joint and cause all of the movement that should go through these pelvis to go through the lower disc areas, the lower 2 lumbar vertebrae, the L4 and the L5. Anyone that suffered a slip disc or disc herniation, any sort of disc injury is going to most likely take place through that L4 and L5 region. A lot of that can be prevented through getting optimal mobility through the pelvis so that there's no unwanted stress through these joints through here. The best way to do that is to keep the hamstrings loose. The hamstrings, you've got three muscles. They attach to the what's known as the sit bone or the ischial tuberosity. They travel down the leg and attach onto the tibia and the fibula. So when I'm rolling that, I'm going to be starting at the top and turning the foot in, turning it out, and then I'm just going to slowly work my way down. Now you may find that over time you're going to get the mobility enough that you can actually put the other leg on there, provide a little bit more tension, a little bit more weight on that area, and it's going to give you an even greater workout. And I'm going to work all the way down onto their attachment points. Make sure you don't roll onto the bone areas at all, staying on that muscular tendinous junction, and slowly work my way down. As I said, it's the most important stretch that you do. Any sort of lifting is you're going to make sure you get the mobility and the flexibility through that pelvis joint. This one's going to help that so much. The second one I'm going to focus on is what's known as the hip flexors. Now the hip flexors attach. You've got two muscles that form the hip flexors. The first one attaches to the front and the sides of the lower lumbar vertebrae. They travel through the pelvis cavity and attach onto the femur. The second muscle attaches on the inside of that pelvis, joins this one here and attaches onto the femur. Now, when you're sitting down, this muscle will actually shorten. So when you stand, it will tug and pull on that lower lumbar area. That's why it's so important to maintain flexibility. Otherwise, you'll find that whole movement, the biomechanics of the pelvis, will be limited. It can be a very hard stretch to do actively. If you're doing it this way, you want to make sure the pelvis is tucked in, slowly moving forward and feeling that deep stretch within the pelvis cavity. I find that can be extremely hard to isolate. That's why I also recommend using a trigger point ball. Now what I'm going to be doing is I'm going to be placing it on the pelvis cavity, just rolling over, and you'll feel a muscle just inside of that, what's known as the pelvis area. If we look at it through here, on the front, I'm going to get the ball and just let it roll into that area. You find a lot of the trigger points will sit in this pelvis cavity through here and really limit the mobility. I'm just going to sit that on that area, come down. I'm going to take a deep breath in, breathing out, and just slowly let it roll in there. Deep breath in again. I'm just going to gradually move up a little bit and breathing out and just letting it sink into that area. What that'll do is it'll give the chance for the ball just to slowly release that muscle and get the flexibility out of that area. One that's very, very important is that it's such a big impact on the hip drive, on the lower back, any forms of ground overhead. You're going to need the flexibility through these muscles. Third and final one is going to be working on the glute muscles. Easiest way to do that is using a roller. There's 3 glute muscles. You've got the glute maximus, the glute medius, and the glute minimus. Very important to get all 3 loose to make sure you can keep that area. Using the roller, I'm going to bend the leg and just slowly roll through that area. and slowly straighten it and bend, rolling it up and down. Now you'll find that this will be really, really sore if you're doing a lot of lifting, especially people that are going back to back with their WODs day in, day out. You want to make sure there's lots of flexibility through this area. I'm turning onto the side to make sure I can get that glute medius and working that through both sides. Doing these 3 exercises, you're going to make sure you keep the mobility in the lower back area, increase the recovery time, and also reduce the chance of lower back injuries. Any questions, let me know. This is a really important area. It's an area that I see a lot of problems in. It can be prevented, especially in the CrossFitters that are doing these exercises. Enjoy.